A fertility clinic at St. Luke's Hospital in Chesterfield is considered one of the nation's best, and that's because Dr. J. Sherman Silber and his team work there.
And if you want a baby, he can help make it happen. Dr. Silber's original book, How to Get Pregnant, has been revised with new information. Things are always changing in that business. Dr. Sherman Silber is live with us this morning to talk about it. Good morning to you and welcome to our program.
Good morning. It's great to be here.
We know that you were a part of this groundbreaking ovarian transplant surgery in 2004. They were twins. One of them has become pregnant, yes.
Oh, yes, and she's delivered a baby.
Aww.
And the second one has become pregnant. And actually, we've done 5 of them already, and all 5 are working.
Wow.
So it's a robust procedure that's very repeatable.
That's awesome. This is the woman from Alabama, right?
Yeah, the first one was from Alabama.
And there she is right there.
Oh, you got pictures.
Oh, they are, rather.
Sure
Oh,
we
they
do.
are so cute, too.
That's terrific.
It's just fantastic.
Well, a lot of people, we've sort of learned over the past 40 years that more and more couples who are trying to have kids a little later in life, late 30s, maybe 40s, that they have problems with infertility. How big of a role is age in this, and what do couples need to know to do something about it?
Well, age is absolutely the critical role, and not necessarily being, like 50 or 45. The incidence of infertility in couples in their early 20s, you may not think there are many of them like that, but there used to be 40 years ago. Couples in their early 20s have only about a 1% incidence of infertility. But once you reach your late 20s, like 28, 16% are infertile. And by the time you're 35, when in the modern world most couples are thinking, well, maybe now we might think about having a child, 25% are infertile. And by the time they're 40, 60% are infertile.
Wow.
It's an enormous worldwide epidemic, and it covers every country: India, China, Europe, the U.S.
So at what point should a couple say, okay, I need help? How can you help?
Well, I think it's important that we now have some simple testing that a lot of people don't know about, where we can really tell them right where they are in their biological clock. We can actually count their eggs, so to speak, or their follicles with ultrasound that's available anywhere. It's not just us. It's just that we first pointed out that the little tiny holes, so to speak, in the ultrasound image of the ovary that everybody sees every day when they do ovaries, they're not really counting them. And if you count them, then you can predict from that just where she is in her biological clock and when she's going to become infertile and what she should do.
All right. Well, interesting information this morning. And since we've got the best in the biz here, Dr. Silber, we're going to do something a little different today. We're going to ask you to stick around for a couple of hours. And we've got a web chat. And so you can ask one of the best fertility doctors in the country questions in case you or someone you know and love is having problems in this arena. Go to our website, fox2ktvi.com. One of the first things that's going to pop up is going to say, go to the chat room. Just click on that. You can enter your name, and then you can ask Dr. Silber your questions about fertility or infertility, as the case may be.
And I understand our web chat's going to be open for 1 hour only. So if you're thinking of something, get your question in as soon as possible so the doctor can answer it for you.
Great. Thank you, Dr. Silber.
Well, it's great to be here and talk to you.
You ready for some more questions?
Ready for lots of questions.
All right, we're going to take you in the newsroom. We'll check in with you again later.
Great,
Thank you, doctor.
Well, thousands of couples struggle with fertility issues in the St. Louis area every year. And this morning, you have the opportunity to ask questions of one of the leading experts in the field. Fox 2's Kevin Steincross is in the newsroom where Dr. Sherman Silber is chatting live online right now with viewers. Kevin.
I tell you what, you guys, this is a great idea. Dr. Sherman Silber from St. Luke's Hospital, one of the best fertility specialists in the country. He wrote this book called How to Get Pregnant, which is so he's a leading authority on the subject, and we've invited him to stay with us for an hour. We've been so lucky to have him do so, and he's answering your questions. You go to our website, log on, and you can ask him a question about fertility. Very quickly, doctor, someone just wrote in and said that she was on the pill, now she's off the pill, and is not having periods. She's concerned, will she ever be able to get pregnant? The short answer to that?
The way to find that out is to get an ultrasound antral follicle count performed, and that we'll be able to count her eggs, and she'll know just where she is in her biological clock.
All right, very good. We've got a lot of interest so far, you guys, so if you have a question about fertility, maybe you're having some problems getting pregnant, now is your opportunity. We've got one of the best in the biz right here in our newsroom. Log onto our website, fox2ktvi.com. One of the first things you see will be our web chat. Click on that, enter your name, and then you can ask a question, and then Maria will handle the duties of typing in what Dr. Silber has to say. So log on, you guys.
Maria's going to have tired fingers today.
It's a great opportunity. Yeah, Dr. Silber is known worldwide, so this is quite an opportunity for our viewers to get some of those questions answered.
For
Fertility issues can often be a struggle for couples. In fact, thousands of couples in the St. Louis area face them every year. And this morning, one of the leading doctors in the field is conducting a live web chat in our newsroom on our website. Fox 2's Kevin Steincross live in the newsroom with a look at some of those questions you're asking this morning. Kevin?
Margie, we're getting a lot of good questions from folks here in St. Louis who are having some fertility issues. Dr. Silber has written this book, How to Get Pregnant, and so he's one of the leading experts. Lots of good questions. We have so many online that we don't have time to answer them all, so I'm going to ask you a couple just here on the air. We can take care of it that way. Here's one from Teresa. I was pregnant through in vitro fertilization after 2 attempts. She had a baby who's now 15 months old. I recently had a hernia repair. My husband and I want to have another child, but have not had success naturally. How soon after having a baby and the surgery can we try in vitro again?
We think that probably 6 months is all the time you have to wait. Give yourself 6 months to heal, and if you want to have a baby right away, you can. Of course, some women might say they'd like to have that child a year old or a year and a half old before they go for the second child, but if you're getting older and you're worried about your biologic clock, you only have to wait 6 months for getting pregnant again.
All right. Tom writes in, I'm in my lower 30s and she just turned 30, his wife. I do have a low sperm count, but the doctors say not to worry about it. What can we do to be successful in having a child?
Well, first place, your doctors may be very wise about this because many doctors you go to will give you every kind of stupid hormonal remedy to try to raise your sperm count, and none of them work. And the sperm counts are highly variable, and they might put you on nutritional supplements. They might even do surgery like varicocele, all procedures that absolutely have no effect on your sperm count. So that part is right. On the other hand, if your sperm count is very low, then we have a technique with IVF that really works, and you don't have to wait, where we inject an individual sperm into each egg, and so no matter how poor your sperm count, even if it's at sterile levels, we can get your wife pregnant with in vitro fertilization the same as if you had a normal sperm count because of this technique called ICSI.
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 All right.
It's short for intracytoplasmic sperm injection, which no one wants to pronounce, so now we call it ICSI.
I'm going to call it ICSI,
right,
folks. All right, here's one more from Tracy. Tracy writes, I've been through chemo twice with a bone marrow transplant. What are my chances of getting pregnant?
Okay, this is potentially a devastating question, because if she had asked us this question before she went through her bone marrow transplant, we could have, through an outpatient procedure, just taken out one of her ovaries and frozen it with this technique that we have now available, and then we could transplant it back maybe 5 years later after she's cured of her cancer and wants to have children, and that ovarian tissue will not have aged. In fact, even forgetting the cancer issue, if she's, say, 25 years old and she doesn't want to have a baby till she's 40, you can take out one of those ovaries, freeze it, save it, it won't age, and transplant it back at any time, and it ovulates normally, and she just gets pregnant naturally. So that's what we could have done. Now, the problem is, if she's already had her marrow transplant, I'm sure the chemotherapy she's had has been so severe, and I'm sorry to have to tell you this, so severe that I doubt if there's any ovarian function left. But we needed to, before your bone marrow transplant, even after some chemotherapy, there's enough ovary surviving. But the marrow transplant is so severe that once that happens, there won't be any return. So you have to get to those cases earlier and freeze the ovary then. But now there is a way you still could get pregnant, but you'd have to use donor eggs with IVF, and I recommend that approach highly. That's your approach.
All right, Dr. Sherman Silber from St. Luke's Hospital, we certainly appreciate it. He's sticking around for a little while longer. Maria's typing in his answer, so go to our website, fox2ktvi.com. You'll see one of the first things that pops up is the chat room. Click on there, enter your name, and you can ask Dr. Silber a question as well. Guys, back to you.
All right, Kevin, thank you. Fertility issues can often be a struggle for couples. In fact, thousands of couples in the St. Louis area face them every year.
So this morning, one of the leading doctors in this field is conducting a live web chat on our website. Fox 2's Kevin Steincross is live in the newsroom with a look at some of the questions you are asking. And Kevin, hundreds and hundreds of people this morning are contacting us.
Yeah, it's sort of a good news, bad news scenario, guys. Good news, a lot of people have been writing in, asking a lot of great questions on our web chat. The bad news is so many people have been writing in, it crashed our system. So I printed out a whole bunch of your questions, and I want to get to as many of these as I can with Dr. Silber from St. Luke's Hospital to answer some of your questions. You ready?
I'm ready.
All right. Elizabeth writes, my husband had a vasectomy reversal 7 years ago, vasectomy reversal, but we still haven't gotten pregnant anymore. Suggestions on what we need to do?
Well, there's two possibilities. Either the vasectomy reversal didn't accomplish a complete perfect reconnection because it's microsurgery and very tiny and very delicate, or may not have bypassed some damage in the epididymis, which that's the delicate tube that conveys sperm from the testes into the vas. So there may still be some obstructive problems giving you a low sperm count or low motility or maybe no sperm even. So if that's the problem, you have to have the vasectomy reversal redone. He just has to have a re-reversal with proper delicate microsurgery. Now if his sperm count is good and you're still not getting pregnant, our data is overwhelmingly showing that it's not related to the male anymore, but it's a fertility problem in the female, and in that event you really ought to go to IVF. So find out if the sperm count's okay, go to IVF. If the sperm count's really poor, then you ought to have the reversal redone.
A re-reversal.
Re-reversed, right.
All right.
Yeah, exactly.
All right. This is a woman who writes, I'm 31. I have a cyst on my ovary since I was 19. Doctors have given me birth control pills to shrink it, but I still have pain every once in a while. Is this keeping me from getting pregnant, and do I have to stay on birth control to get pregnant?
That's a very good question. You should be on birth control pills if you're not trying to get pregnant, because that will suppress the cyst. Now, I'm assuming it's a simple cyst that really doesn't need any surgery, because if it needed surgery, presumably over all these years, your doctors would have said this is a complex cyst and we need to operate on it. But assuming that it's not a complex cyst, the birth control pills suppress it, and when you want to get pregnant, you just go off the birth control pills. And then if you're not getting pregnant or your periods aren't regular over the course of many months, then of course you would still have to consider IVF or infertility treatment. But my guess is when you go off the pills, you're going to just be fine and ovulate normally.
All right, final question here that we have time for, and I think it's going to be a quick one. Will daily intercourse have a positive or negative effect on my being able to conceive? My husband and I are in our early 40s.
Daily intercourse is what you need. The joke of it is that so many couples are misled into thinking they should save up all the sperm and only have sex just when she's ovulating, and that creates so much tension and so much anxiety that it actually suppresses ovulation. Your emotions can turn off ovulation. So daily sex is a lot better than scheduling sex. On the other hand, you mentioned that your wife is 41, and at age 41, she's on the very, very edge of her biologic clock. She should get an antral follicle count ultrasound, as I've said before today, to find out just how many eggs she has left so you can decide whether you should rush into IVF or not.
Great information this morning. Dr. Silber, thank you so much for coming in.
Pleasure to be here.
Participating in our website. Again, our web chat, so many responses that it shut down. We do still have some of your questions, and the folks at St. Luke's are telling me that if you call his office, they'll try to get to as many more of those questions as they can. The number, 314-576-1400. 314-576-1400. And when our website comes back up, we'll post it on our website as well, because we want to get as many of these questions answered as we can. Guys, back to you.